Hey guys, Dr. Scott Nall here from thevillageosteopath.com. Today I'm going to start a two-part series on stem cell therapy, the first of which is going to cover safety and efficacy of the procedure, and the second part of the series is going to cover the actual kind of nuts and bolts of the procedure itself, what to expect and whatnot. So let's go ahead and get to safety. The main thing that's on a lot of people's mind when it comes to stem cell therapy has to do with, will this cause cancer? We're putting cells in there that can turn into pretty much whatever they want. Is it going to turn into some kind of crazy cancer cell and start growing out of control and alter my life in a negative way? Well, the answer is, safely enough, no. There have been thousands of stem cell cases that have been performed across the world, and to this date there have been no reported cases of cancerous growths that have occurred because of stem cell therapy. There have been some pretty wild studies looking at stem cells, dumping them into places with huge amounts of inflammation and huge amounts of abnormal cells being involved, and in no case did it cause an increase in cancerous growth. That being said, there is kind of a consensus among physicians who do stem cell therapy that putting the stem cells in a person who has an active cancer is probably not a good thing to do. So normally if you have an active cancer going on that's known, we will not treat you until that's been taken care of. Then there has to do with complications from the procedure itself. Now, the complications to the procedure itself, it really depends on how the harvest is done. So the harvest is when we go in and get the cells. So there are bone marrow aspirates that can be done with that. There's also a lipoaspirate that can be done. And risks of both procedures are a little bit different. I would say overall the risks in the lipoaspirate are a little bit higher, but overall, as far as if you look at risks of having both procedures of something bad happening, they're pretty low. The main thing we worry about in this case is getting an infection under the skin, which is why we usually have you take an antibiotic 2 hours before and 2 hours after, just like you would with a lot of other surgical procedures that are done, and that cuts down on that quite a bit. Otherwise, with the bone marrow, unless the trocar is entered into an area where it's not supposed to be entered into, the safety profile of the procedure is very good. Now, how do we keep from doing that? Well, most places that do bone marrow aspirates are doing those under what's called blind conditions. In other words, the physician or the practitioner that's introducing the trocar is just pushing it around with their finger and feeling where it's going to go and hope that they get the right spot. When we do it here in the office, we use an ultrasound to guide our trocar placement, and we're also able to scan through the area first to make sure you don't have any anatomical variations that might cause a complication later, such as an extra artery or an extra vessel or an extra nerve that might be growing in that spot, because we all are a little bit different when we're made. So when we look at that area, see nothing there, then we're able to place the trocar very precisely using ultrasound guidance to make the procedure very smooth and very safe and as relatively pain-free as possible. Now, when we come to the lipoaspirate part and safety, there's one other thing we have to worry about, and that has to be would you happen to have some type of hernia that's pushed your insides outside, so to speak. So in other words, your small intestine is herniated through the fascial integrity there, through your abs and into the subcutaneous fat space, and we're running a harvester trocar through that area to pull fat out, and we could enter the bowel. So ways to check for this is we do a thorough exam before you come in and have this done. So we look at the abdomen, make sure we do a thorough history where we talk about, hey, have you noticed any bulges in this area? And then number 3, I'll take an ultrasound probe and run it across the abdomen and see if I see anything that looks suspicious. And that last section is something that we do here in the clinic that's almost done nowhere else in the United States that I know of, where we do a pre-check for any type of herniation. So we're actually going above and beyond the normal safety rules when it comes to lipoaspirate, and the lipoaspirate complications are relatively low anyway, so we're taking it to an even higher level here at the Village Osteopath. So that covers it, guys. So those are the main things we have to worry about as far as complications when it comes to the harvest of your stem cells, when it comes to safety. So number 1 is when we use these cells, cancer actually happen because these differentiating cells turn into new cells? The answer is no. Number 2, what about complications from the harvest? Complications are relatively low, and then as you've heard here at the Village Osteopath, we use advanced imaging techniques to make it even less likely that these kind of things have happened. And so far, to date, we have not had any complications here at the Village Osteopath when it comes to bone marrow or lipo harvest. So you don't have to worry about that. And the final thing we look at is actually the terms of injecting the stem cells into your body. And people are kind of worried about, oh, was that going to hurt? Is there anything else going on with that? And the answer is relatively no. The side effects or the complication rate when it comes to injecting the stem cells is exactly the same as you would get with any other type of injection into your body. Anytime you introduce a little piece of metal, aka a needle, through the skin, there is a chance of infection, but we actually clean the skin above and beyond, just like we do everything else here in the office. We go above and beyond the standard of practice to make sure that you have the best experience possible. The standard of care right now is to use an iodine preparation. You've probably noticed this anytime you go in to get a shot, maybe at your doctor's office, you'll get like this yellow stain on your skin where they're wiping you down with iodine. The problem is that in order for that to be done correctly, the correct procedure for that is that iodine is supposed to be put on, left for about 5 minutes to dry, and then wiped off with alcohol afterwards to actually get a complete clean. And I've never seen a doctor do that before unless it's in surgery when they're having a surgical tech do it. So what we use here in the office is we use something called chlorhexidine, which is even a step higher in terms of antiseptic use to kill off bacteria on the skin to make sure that the safety ratio is as high as possible. And so what is the chance of getting an infection? Well, research shows it's about 1 in every 10,000 shots. So we're hoping here at the Village Osteopath that our safety is even higher because we're using a higher standard of cleanliness, so to speak. So I hope that answers your question as far as safety is concerned, both for the lipoaspirate part, for the administration part, and actually when the stem cells actually get in your body themselves. So far, it seems to be a very safe procedure.